increase. And the question is, where does thyroid hormone? Which explains why a drug like levothyroxine is the second most commonly prescribed drug, because once you're on it for life. So it's a very good drug from a commercial model. So then the question...
Yeah, go on. How would a diet help then?
Well, yeah, so that's the question. So then the question is, where does diet play into this? And we've actually found that in addition to low carbohydrates appearing to increase the effectiveness of thyroid hormone, so whatever thyroid hormone you have in your circulation appears to work better on a low carb diet, two foods actually appear to provoke this autoimmune disease. So they did a pilot study of a randomized controlled trial a few years ago now, where they took females with known thyroid disease, Hashimoto's disease. So we detected these antibodies in their blood, the thyroglobulin and the thyroid peroxidase antibodies that was circulating in the blood and attacking the thyroid gland. And they randomized them to two diets. One was the normal diet, just keep eating what you please. And the other group was to go on a gluten-free diet. So gluten, you'll remember, is that kind of thing that we ask celiacs to avoid. It's contained in barley, rye, and wheat. And it won't surprise you to know that the people with celiac disease have a vastly increased risk of Hashimoto's thyroid disease and vice versa. It goes both ways. So they put these people on a gluten-free diet. And then they followed up both groups and they were randomized, which means that all these confounding factors were controlled. So the only difference between them, if there was a difference, would be caused by their dietary intervention. And they found that in the group that continued their normal diet, as I was taught in medical school, these thyroid antibodies just kept on increasing and increasing and increasing. Predictable. But in the group on the gluten-free diet, over a 6-month period, their thyroid antibody levels on average significantly dropped. And this, in my mind, in my knowledge, is the first clear piece of evidence that we can actually intervene with the background pathology of a lot of thyroid disease. Now, it's not all thyroid disease is Hashimoto's, but a lot of it is. A lot of this underactive thyroid, when you ask your doctor what caused it, you'll often just get a blank look and a bit of a shrug. But the fact is, it's not working because it's been destroyed, and almost certainly the cause of that destruction has been an autoimmune process where your body has attacked itself. And we know that cutting out gluten is one strategy that will improve that to some extent. The other element in the diet that appears to be also useful, which interestingly, it has some cross-reactive autoimmune effects with gluten, which basically means if you've got an autoimmune problem with gluten, you're almost certainly you're very likely, very possible to have an autoimmune reaction to this other substance, and that is dairy. And that's very unfortunate for people on low-carb and ketogenic diets. But certainly my recommendation, if I diagnose a patient with an autoimmune thyroid disease, if we measure your blood and find that you've got these antibodies circulating that are attacking your thyroid gland, I'll very often recommend eliminating gluten and eliminating dairy for a period of 6 months and then monitor your thyroid antibodies and see if we can actually dial down that immune attack.
So let's just explore the gluten and the dairy a little bit more. I mean, I always feel that gluten, poor old gluten, cops all the blame, and I suspect that gluten is just part of the whole picture. It's really just wheat, isn't it? I mean, that's the major culprit, and there's so many of us are allergic or that wheat is toxic to us, and it's gluten and a whole lot of other substances within wheat.
And this is almost certainly why ketogenic and low carb diets are so effective, because the gluten-containing grains and wheat and these kind of things are very high in carbohydrate. So what's the first thing you cut out when you go on a low-carb diet? You cut out the bread. So almost certainly when we do these studies and we see thyroid function is improving on ketogenic diets, it's not just going to be the carbs, but I do believe the carbs do play a very important role because there is an interaction between thyroid and insulin resistance. But I have no doubt at all that eliminating of the wheat is a key factor. Just because wheat contains carbs, you get rid of that, That's a big supply. It's got other bad stuff in there as well, besides gluten, as you say, things like wheat germ agglutinin, which is a potent trigger of a potent risk factor in susceptible individuals for other autoimmune issues as well. The thing to understand about autoimmune disease is they're like Pokemon. So you've got grandkids, Peter. You may have heard about this. I know they weren't there in the 1920s, but so once you get one, you've got to get them all. So what do I mean by that? I mean, misery loves company. So the single biggest risk factor for having one autoimmune issue is having another autoimmune issue. That's because the root cause of having one is very similar to another. When I said to you that people with celiac disease are very much more likely to have autoimmune thyroid disease, that goes for a bunch of other autoimmune diseases. In actual fact, in medical school, we were taught autoimmune clusters. So we were taught that they went together so tightly, we often had constellations, that it was almost mandatory. For example, if somebody was diagnosed with a celiac disease, that you would also have to test for autoimmune diseases affecting B12 and of the thyroid and a bunch of other things as well. So that's a real big problem here. So almost certainly, if you identify one autoimmune issue and you take steps to address that through diet, then if you get improvements in that area, then you're also very likely to have improvements in these other associated areas.
Now, I'm glad you can remember what we were taught in medical school. It's way too long ago for me. So just before we go off wheat, I mean, people often sort of say, well, we've been eating, wheat products, bread and so on for hundreds and thousands of years. Why suddenly now does wheat seem to be so sort of toxic to so many people?
Well, I think there's really two main reasons as to why. So the first one, actually three main reasons. So the first one is we have different cultivars of wheat. So the breeds of wheat we have now is not the same as it was before. Now, one of the natural defenses that crops have against pests, little insects that would eat them, are natural chemicals called lectins, and they're essentially natural pesticides. Now, through modern breeding and engineering of wheat, we've been able to breed types of wheat products that actually need less herbicides and pesticides added to them because they actually produce it themselves more internally. So the chemical composition of some of these potentially deleterious chemicals is much greater in a modern cultivar of wheat than it is in an ancient cultivar of wheat. And I've got many patients who will say they can consume bread from an Italy or, where they've still got maybe more traditional farming techniques, where in Australia we've mastered mass wheat production. So bread in Australia is very different. Another problem is the processing. So modern bread processing may only ferment bread, where you actually break down things like gluten and these other problematic chemicals, for about an hour. Compare that to more traditional, say, sourdough, which is fermented for 72 hours. And you can begin to see that these industrialization processes, they actually change the nature of the food we eat. And the third massive factor is pesticides. So I'm sure you've heard of glyphosate. Now, glyphosate is an organophosphate pesticide that is used widely around the world. And I believe that farmers are allowed to spray this onto crops, onto wheat, 3 weeks before harvest in Australia. And they may often only do it for reasons like trying to dry the crop out. So there have been some estimates that we've had, just a ridiculous increase in the last couple of decades, even a 500% increase exposure in the general population to these chemicals. And these chemicals actually indeed are detectable in our bodies. So there's no doubt about it. And I'm sure you're aware of the lawsuit that I think Monsanto is currently facing in America, and there's been some talk of some pretty hefty financial penalties. So I think there's more to come out on this story. But in terms of, you have to understand that, if you grew up, eating bread and it was fine and it was made with, pre-industrial techniques. It was, your mother might have baked it in the kitchen and it was done with these pre-GMO crops and it didn't have all this glyphosate sprayed on it, then that's a completely different beast to what we're consuming now.
Yeah, absolutely. And just to finish on the dairy side of things, when you say dairy, I mean, is there certain dairy products that tend to be more sort of allergenic or more inclined to sort of cause these issues than others? For instance, compare, cream and milk and butter and yogurt. I mean,
Yeah.
You think?
Yeah, absolutely. There's very good evidence for that. In actual fact, there seems to be something about the fermentation process that makes dairy less problematic. So yogurt can be a very good option, but there is a caveat. So if you go and buy your yogurt from the store and have a look at the ingredients, if you see that it's got milk, culture, and maybe a yeast or something and nothing else, then that's going to be a great yogurt. But if you look on the label and you see that they've also got added milk solids, so what they'll often do, they'll often ferment the dairy, which is great, and they sort of reduce the quantity of some of the problematic components. And then they'll just add a bunch of milk solid back in just for a bit of extra protein or fat or whatever it is they're aiming for. So if you're worried about whether dairy might be provoking autoimmune issues, and you say, but I love it, I'm not going to give it up, I still have to have some dairy, I'm going to have yogurt, then there's a lot of nuance. You check the label and make sure that you're not having a yogurt with added milk solids. So, I mean, the point is that the food we're having now that we buy is completely different to the food that our grandparents were consuming.
Yep, absolutely. Look, we want to leave time for questions, but just one last thing. You've obviously had a lot of experience of managing thyroid issues with diet. Tell us a little bit about your experience with managing putting these patients onto a sort of a low carb, ketogenic, gluten-free, sort of dairy-free. What sort of response is sort of typical?
Well, the first thing we look for is the attack on the thyroid, because I don't believe it's useful to improve the sensitivity of thyroid hormone if you're going to continue to destroy the thyroid gland and ultimately not have thyroid hormone at all. So I always have a large focus on that. And typically we do see a slow decline in thyroid antibodies. The thing about it is it can be very frustrating because these antibodies can live in your blood for months and months and months. We know, for example, the antibodies against celiac disease that we can diagnose on a blood test, they can live for 15 months in the blood. So just because you changed your diet 2 months ago and you get another blood test, don't expect to see dramatic reductions, and don't get despondent if it hasn't dramatically reduced in a short period of time, because these things have a long half-life. And that's why I often use 6 monthly intervals to test the thyroid antibodies. I wouldn't really expect drastic reductions in shorter periods of time. But I do like to get visibility that we actually are, hopefully, and we often do, we usually do get some reduction in the thyroid antibodies. Number two, a lot of people will be on medication, and if we notice that their TSH, the thyroid stimulating hormone, is actually getting too low, then we do need to gradually reduce the amount of thyroid medication that people are taking. On the flip side of it, a lot of people that I do see come to me and their thyroid activity is underactive, it's underdone, and I will often recommend a modest increase in the thyroid hormone dosing, or potentially some compounded bioidentical thyroid hormone. But in general, the responses that we will see will generally expect to see over time a reduced attack against the thyroid, and would often also observe an increased activity of the thyroid, especially on people who aren't on medications. We'll often see the TSH will come from quite a borderline or equivocal level of 2.5 or 3, and I like to get it down to clearly below 2. And that's pretty typical for a lot of patients.
What about symptoms? And what effect does it have, a dietary approach have on symptoms? All very well to say, okay, the blood tests improve, your TSA, your antibodies reduced, your TSH comes down, but that's fine. But really, what our
Yeah.
I don't
Well,
know is
people go to doctors because they feel lousy. So a bit of a caveat here. So generally, people feel so much better. I quite honestly, hand on my heart, every day people say, I just feel better. I'm sleeping well. I just feel great. And those patients, thank you. I mean, you make my day worth working. But the question is, do we have visibility on exactly? Because as I said before, when we put people on these diets, we often fix more than one pathology. We're addressing insulin resistance. We're addressing high blood sugar levels. We might be addressing gut inflammation and celiac-related issues, as well as thyroid issues. So the beautiful thing about a ketogenic or a healthy diet is that it addresses multiple pathologies at the same time. So can we necessarily attribute these improvements we have in patient well-being to thyroid pathology only? No, probably not. So in the patients who I change, if the only thing we do is to go from levothyroxine to a bioidentical thyroid hormone, then yes, I think that's fair enough. We can attribute any changes because that's the only thing we've changed in isolation. But when you do a nutritional intervention, we expect that you will feel better. Is it feeling better because you had these other diseases, or is it feeling better purely because we've improved the thyroid disease? I don't have a great visibility on that, but I honestly don't think it matters, so long as you feel better.
Long as you feel better, that's the main thing. Yeah, that's good to hear. I think if we're giving sort of basic advice, really, I mean, people say, well, how ketogenic, how this, how that. I mean, it's really just avoiding processed and ultra processed food, isn't it? I mean, I think if we can, because a lot of these toxins that are going to affect autoimmune and so on are in processed food. So if we just stick to real food, to sticking to the outside of the supermarket, avoiding those middle aisles, then you're really doing yourself a huge favour.
Couldn't agree more.
All right. Let's. I might hand back to Zoe, and Zoe can shoot the questions. And